Hello and welcome to Hurst. I'm so glad you're joining me this afternoon. My name is Robin. I have been nursing for 30 years. I have worked as a Hurst instructor for the past 10 years. I'm super excited to get to talk to you today. We're going to talk about how to pass the NCLEX, how to be successful on the NCLEX and beyond. Now, we are a company that is different. What do I mean by that? Well, our founder, Marlene Hurst, she is a nurse. Throughout our company, you will find a nurse working in every department. So you see, we are a company, y'all, that was built by nurses for nurses. We know exactly what you're going through. Wherever you are in your nursing school career, we have been right there. We know what it's like to be a student. 9 out of 10 students, though, they tell us they would recommend our review to their friends. They have great success with Hurst and they want to share that. We love that number. It's one of our most favorite numbers here at Hurst Review. We have a 98% first try pass rate. That's right. If you do everything we ask you to do, and we're even going to supply you a checklist for success that you will be able to check off as you do everything we ask you to do. You will enter the testing center with a 98% first-time pass rate. For over 30 years, we have been helping students pass the NCLEX the first time. Now, let's talk about that NCLEX just for a minute, okay? Let's talk about it just for a minute. The NCLEX is a safety test. It is designed to protect the public from unsafe nurses. Before they just hand you a license, they need to know that you can keep everyone safe. You can keep yourself safe, your coworkers safe, and your clients. The name of the game with the NCLEX is to keep everybody safe and alive. And again, we have been teaching students how to be safe nurses for over 30 years. Now, the NCLEX, it is different, though, from your nursing school test, okay? It is different, but we are here to prepare you for that. All right, now, my friend Thomas is going to put a question up on the screen. I want you to chat your answers, okay? Even if you're not sure if it's correct or not, I want you to chat that answer. Put it in the comments because what a great way to learn. We learn when we miss a question, don't we? Yes. So I will be right back, and you and I will go over the correct answers and the rationales. All right, let's read this question together. You are the nurse and you are assessing a client post-thyroidectomy when the client reports mild neck pressure. What is the priority intervention? All right, let's discuss it together. First of all, do you see that bolded word, priority? Words like first, initial, best, most, they all mean the same thing. When you see a bolded word like that, they're telling you, they're asking you, if you can only do one thing, what are you going to do? Out of the options that you have listed there, what is the one thing you're going to do? What is the one thing that you're going to do that can help your client, okay? What is the most important thing for you to do? In this question, This client had a thyroidectomy, right? That is a surgical procedure. And now the client has mild neck pressure. That's another word I want to talk to you about. You see words like mild and small and scant. Words like that, just cross those out too. Don't let them fool you. This client has neck pressure, okay? So we are going to assume the worst. If we assume the worst, what are you thinking that could be going on post-thyroidectomy? What are you thinking right here? Bleeding or swelling? Yes, bleeding or swelling. Good job. Because if they have bleeding or swelling going on, they could have some neck pressure. And what did I say? We are going to assume the worst. So if we assume the worst, neither one of those is good. This client's airway could become compromised, right? Yes, and they could not breathe. Look at number 4, reassess in 15 minutes. Now, we are not going to do that. Let's just go ahead and get rid of options like that, okay? Listen, that is delay in care. Do you ever want to delay care when taking care of one of your patients? No, you can't delay care, so let's get rid of that. All right, look at number 2, instruct the client to stay in bed. Ooh, students love this answer. Why? Because it sounds like a good, safe answer, right? I know you may have liked this one because you're worried about the client falling, but the safety issue in this question isn't a fall. It's bleeding and or swelling, okay, in the airway. So you have got to pick an answer that's going to take care of that. If you pick number 2, you're saying, well, I would just rather them die safely in bed than out on the floor. That's not the message that you want to send to the NCLEX, right? No. All right. That leaves us to number 1, remove the dressing, or number 3, place a tracheostomy set at the bedside. So let's talk about this a little bit more. Now, we know as nurses post-thyroidectomy that we need to have a trach set at the bedside, right? Well, let's just say that you chose place a tracheostomy set at the bedside. I want to ask you a question. By going and getting a trach set and bringing it and setting it at the bedside, did you fix the problem? Your client is reporting neck pressure. Did you fix that? Did you fix that problem? No. Now, we may need a trach set, but you did not fix the problem. So, what you have to do right here is remove the dressing. Remember, all of the options that are listed, you already have an order for those, okay? You already have an order for those. So you have got to remove that dressing so that they can breathe better, right? All right. Okay, now, what do you get with Hurst? Let's talk about a few things that you get with Hurst Review. Okay, the first thing you're going to see is 1,500 practice questions. You get NGN case studies plus 1,500 practice questions. Now, that's a lot of questions, but the NCLEX is not about questions. It's a process, and I promise you, we're going to give you all the questions that you need. And as soon as you sign up for your account and you activate your account, you will have access to 1,500 practice questions and the resource library. The resource library gives you documents, and they're brief and concise. Let's say you have a certain topic that you have trouble with. The resource documents, they are brief and concise, and it's just some extra content that's going to help you master that content. Infection control, pharmacology, things like that, okay? Whatever your weakness may be, and there's a lot of topics in that. The next one you're going to get is that core content. What is core content? Y'all, that is that content that you have to know without a doubt and without hesitation if you want to pass the very first time. Look at the topics right there. Fluids and electrolytes, cardiac, respiratory, orthopedic, all of that content you will get in your live review, okay? And we're going to teach it to you in a way that you will pass the very first time. So you get all that core content, and that is that content, again, that you have to know without a doubt and without hesitation. The next thing is the fabulous Hurst workbook. Students love it. The only way to get it, though, is to sign up for a review. We do not sell those separate. So you get a printed workbook, and then that that has that study plan, that checklist in there that I told you about. And once you complete your workbook, that workbook will become your study guide. And that's what you will use to prepare for the NCLEX. Okay, what do we have next there? Let's see, NCLEX testing strategies and scenarios, and we do that in all the content, y'all, and we start that on day one. NCLEX testing strategies. We're going to walk you through this content, and we are going to role model for you, and we are going to teach you the way you have got to know it. Let's see, the next thing you see right there, like, let me give you an example of like some content strategies. If you have a client that is anxious and restless, we teach you to think hypoxia first, okay? So we're going to give you all kinds of testing strategies, scenarios. What about a test-taking strategy? Well, assume the worst. Fix the problem, like that practice question that you and I just did, okay? And there's over 40 of these throughout our review. Continuing on, after each one of your reviews, your topics, you will have the option to go in and take a post-content quiz after every lecture. Well, y'all, that is an excellent way to evaluate yourself and just see where you are, right? Students love to do that. They love to take that post-content quiz after every lecture because then they'll kind of see where they are. And then we have something that we call the icing on the cake. We have 4 NGN readiness exams. These will let us know if you are ready to go and sit for your NCLEX. They have case studies, all those NGN question formats, clinical judgment standalone, and of course, we have about 63 traditional standalone. We want you to study and learn the content the way that we ask you to, and then you will take your readiness exams just to see where you are and if you are ready. So before the review ever starts, what did I say? You will get that fabulous workbook and you will have access to your 1,500 practice questions and your resource documents library. During the review, you get that core content, that content that you have to know without a doubt and without hesitation. There's that fabulous workbook and of course NCLEX testing strategies. We'll show you all kinds of animations and things that will help you understand that content, okay? Those NCLEX testing strategies, again, they start on day one and they get you to thinking. All right, Hurst works and here's how. Let's look at this next slide and we're going to walk through it. You will have a 9-month access to your account, okay? Specialty lectures, what are those? Those are some lectures that you will do on your own in your online account, okay? And then we make sure that you get plenty individual study time. After you complete everything in your account, you will take your readiness exams. We have a certain score that you must score, and that will let us know if you are ready, okay? Now, let's say you take the first one and you do really well. Do you think it's important to go ahead and take the other 3 as well? Absolutely. We have 4 readiness exams, and we will want you to complete all of those. So some of the options that we have Hurst in Stream, a Hurst Live review, and Hurst Now and Hurst Now Plus. Let's look at this Hurst Live right here, the Hurst Live and the Hurst in Stream. Hurst in Stream, that is streaming, a live streaming event. It comes to you. We have convenient schedules. It's a 3-day review. You will be able to interact with your instructor. You will be able to chat and get an answer back in real time. You will have those 1,500 plus NCLEX style questions in the Q Bank. Resource library, 3 days of live must-know content. And then in the Hurst in Stream and Hurst Live, you will have a 14-day bonus. What is that? Whenever you choose to, and we like for you to study and finish everything in your account, you can go back and access that 3-day live review and watch it as many times as you want to, y'all, in that 14-day period. Students love that. They may they may pick one of their weak areas. It may be cardiac or it may be orthopedics, and they go back and watch that core content, that lecture, as many times as they want to in that 14-day period. 9-month access for the RN, which includes your specialty topics. There's those readiness exams, okay? And all of these are taught by Hurst as expert faculty. The next one I want to talk to you about is Hurst Now. What is Hurst Now? Well, that is a video, okay? That it's an on-demand video. You would work at your own pace. If you don't need structure and you can do things like that on your own, this one may work for you. And you will have a 90-day access. You will get that fabulous workbook. You will get the 1,500 question banks, that must-know core content, and you will get the readiness exams. Hurst Now Plus includes Elevate. What is Elevate? Well, I'm glad you asked. Let me tell you about Elevate. Now, Elevate can be added to any of our Hurst reviews, okay? Any review that you choose, RN and PN. This is called your study buddy, all right? It was developed as a companion course for the RN and PN students. It dramatically decreases your test anxiety. It improves your clinical judgment skills. Why do you want to do that? To be a better nurse, right? Don't you want to be the nurse that hospitals want to hire? Absolutely. It gives you structured modules, video lectures, quizzes, clinical objectives, and a lot of NCLEX study tips. Students ask for something to guide them through their study once they took their formal review, and that is how Elevate was created. What makes Hurst Review so unique? Well, let's talk about it. We have a 98% first try pass rate. That's right. 24/7 expert, NCLEX experts. That's all they do is focus on the NCLEX. Y'all, we do not work with any other profession. Law students, accounting students, med students. The NCLEX is our expertise, and that's what makes us so unique. We are a 3-step comprehensive plan. NGN specific strategies, okay? NGN specific strategies. Clinical judgment. We are a critical thinking class. We are an application class. Listen, we want you to apply the knowledge that you have. Didn't you learn a whole bunch of stuff in nursing school? It's in there. You have learned it. And now we help you take all of that knowledge that you have and apply it to all these different questions and in these many different scenarios. And we also have a money-back guarantee. For some reason, if you are unsuccessful, we have a money-back guarantee. Okay, let's practice another question together. Thomas is going to put a question on the screen. I'm going to give you just a minute. It's a priority, and I want you to tell me what you think the answers are. I will be right back. All right, let's read this question together. You are the nurse, and you're caring for a client post-colonoscopy. The client reports a small amount of abdominal discomfort and there's a drop of bright red blood on the sheet. What is the priority nursing intervention? All right, do you see that word priority? What did I say? If you can only do one thing for your client, what are you going to do? You've got to fix the problem if you can, and you've got to be a safe nurse and keep everyone safe and alive. So look at the stem. I see that my client has had a colonoscopy, right? They've got a small amount of discomfort and there's a drop of bright red blood on the sheet. Now, if you're looking at this like an experienced nurse, they may be thinking, oh, that is normal. That's going to happen after a colonoscopy. But I want you to think like a brand new nurse, okay? So what are some big complications post-colonoscopy? What are some of the things that comes to your mind? What are some of the things that comes to your mind? Let's see. When you think about that, post-colonoscopy. Are you thinking hemorrhage, bleeding? Yes, absolutely. Do you see that small amount of abdominal discomfort? That looks like maybe a perforation to me. A drop of bright red blood on the sheet. They're hemorrhaging, right? Listen, you see drop and small, that small amount of abdominal discomfort, or a drop of bright red blood. Get rid of those words. I want you to assume the worst. If you assume the worst, you would assume that they're perforated or they're hemorrhaging, right? Absolutely. So, you've got a problem in every question, and it's your job to fix the problem, okay? Again, assume the worst, and you will be able to fix the problem. Look at number 1, reassess in 15 minutes. Now, we have already decided we are not going to do that. That is delaying care, right? That's right. We are not going to do that. So that leaves us with, look at number 4. Instruct the client to stay in bed. Again, y'all, I know what you're thinking. If the client stays in bed, they're going to be safe. But did you fix the problem? No. You have got to find something that's going to help your client right now. You did not help with their abdominal discomfort and the bright red blood on the sheet, did you? No. So, again, we are not going to instruct the client to stay in bed, not as a priority. So that leaves me with number 2, call the primary healthcare provider or call for a hemoglobin and hematocrit. All right, remember, you already have an order for everything that's listed there. So, are you going to call for a hemoglobin and hematocrit, an H&H? Let's say that you decide, you've already got an order for it, but let's say that's the answer you picked. I am going to call and get an H&H. Well, what are they going to call and tell you? The lab, they are going to call you and tell you that you have a really critically low H&H, right? So now what are you going to do? You chose the answer, call for a hemoglobin and hematocrit. What are you going to do now? Nothing. You've already chosen your answer, right? So you're just going to click 3 and move on to the next question, right? Did you fix the problem? Did you help your client? No. So in this situation, the only thing we can do is number 2. We have to call the primary healthcare provider. We have to have more orders, right? Yes, we have to have more orders in order for us to help our client. All right. Let's do another question, and we're going to take a question that we've already done, and we are going, that thyroidectomy where it was a priority, we are going to change the format. It is now a select all that apply. Use your knowledge what you know about select all that apply questions, okay? Ask yourself in each one of these options, am I going to do that? Is that true or is that false? And I want you to choose all of the true options as the correct answers. Remember, there's no limit on how many can be correct. It could be 1 or it could be all of them. I'm going to give you just a second. Chat your answers and I will be right back. Okay, what are you thinking about this question? Have you got your answer generated? Let's talk. While the nurse, and you were the nurse, you were assessing a client post-thyroidectomy, the client reports mild neck pressure. What action should you, the nurse, take? Select all that apply. Okay, the client reports neck pressure. Cross out that word mild, okay? So they are reporting neck pressure. So let's talk about it. Ask yourself right here, is this true or is this false? Are we going to do number one, remove the dressing? Before, it was our priority, right? So we're still going to do number one, yes. Instruct the client to stay in bed. Well, that was not our priority before, but that is an appropriate intervention. We don't want them up out of bed and falling, right? No. Okay. Number three, place a tracheostomy set at the bedside. Now, we said post-thyroidectomy, as nurses, we know we should have one at the bed. So absolutely, that is an appropriate intervention. So number three is true. Are we going to reassess in 15 minutes? If a client walks in there and you're talking to you're assessing your client and they tell you this, are you going to say, well, I'll reassess you in 15 minutes, so I'll be back in 15 minutes? No, that one is still false. Elevate the head of the bed. Hey, nothing wrong with that. That's an appropriate intervention, so absolutely. Now, look at number 6, activate the emergency response team. Hey, what is the emergency response team? That's the code team, right? Listen, do we need a code team right now? If you activate the emergency response team and they come running in your client's room and your client just told you they're having a little neck pressure, what are they going to do? Nothing. There's nothing for them to do except scare your client to death, right? That's right. So number 6 is not an appropriate intervention at this time. So look right here. Your correct options are number 1, 2, 3, and number 5. I hope y'all did well on those. Now I'm going to show you a slide where you can scan the QR code right here, and you can make sure that you don't miss out on any of our free events. Invite your friends. Everyone needs to know about Hurst Review. Invite your friends and join us. Check out the schedule, hurstreview.com/free-events. You can do it that way, or scan that QR code. Mini reviews, NCLEX challenge questions, and everything you need to know before you go and sit for that NCLEX. Hey guys, we are accepting PayPal, Google Pay, those are just some options, and coming soon is Apple Pay. So we're excited to share that. Guess what I have for you? I have a discount. Free 2025. That gets you $40 off of your in-stream, $25 off of Hurst Now and Hurst Now Plus, which included Elevate, and Acid Base Essentials. Acid Base is a 4-part series. If you struggle with Acid Base, check out hurstreview.com. Check out all of our products. There may be something on there that you're really interested in. Our home office phone number, call us. Someone will help you and guide you through the website, or if you have questions, someone here can answer those. Make sure you're following Hurst Review on all social media outlets. My friends Ashley and Sarah, they will keep you up to date on what's going on in the Hurst world and in the NCLEX world. And guess what? They also have a podcast. So check out our podcast, okay? Hurst Review Podcast. All right, that's all I have for you. Let's see. Anybody have something? Is this electrolyte webinar? No, fluid. I will send you a message, Nisha. I'll talk to you in just a second. Okay, so I want you to stay safe. Hurst Review hopes to see you again real soon, okay? Take care, and bye for now.